And then we can start off with questions. Share screen. Here we go. Okay. All right. Does anyone have any questions? Alan's going to help me read them because I can't see the chat. So if you have questions, let me add them.
Yeah, so we have two questions here, Rick. One of them is from Annie, and I'll unmute her in a second. She says, is your QL muscle the same as sciatica? So let me find her here. And Annie is here. There she is.
Hi, Annie.
Hi there.
All right. I can't see you, but I can hear you.
Yeah.
All right. So let me go. I'm going to go get another model to show you the answer. I'll be right back.
Okay.
Okay. So here's the QL muscle, right?
Mm-hmm.
It starts at the hip and it inserts into all 5 lumbar vertebrae and it goes up to here. So that can contribute to back and sciatic pain on this side. But guess what? The real question is, why is the QL either tight or spasmed or whatever? That's the real issue. So the QL is part, remember how I showed that picture of the whole pelvis being higher and the ribcage being lower on that side?
Yes.
Well, the QL is one of the muscles that's holding all of that into place. It's locked there. All right. So we can solve that. That's happening because of a problem, usually with the same side leg, like I said. But just addressing the QL, I mean, there's many other muscles too. There's the internal and external obliques that run down here. There's the transversus abdominis. There's the latissimus dorsi. They all run down here too. The QL is just one small one, right? So what we need to do is fix that whole, and the issue is that most people don't know how to address the internal and external obliques or the latissimus dorsi, all right?
Mm-hmm.
And so they focus on the QL as the problem. Because if you push on that little deep muscle, you might get a referral of sciatic pain in your leg. Is that what's happening with you?
No, but it bothers me a lot.
Okay.
So I think
My guess is,
I think I have one of those pictures up there.
What was that?
I think I have one of those pictures up there.
Oh yeah. Oh,
Yeah.
of the people.
Yes.
Yeah. So that's what I was just gonna say. Have someone take a picture, see if you've got a side bending problem. I bet you do. If that QL is bothering you, all right.
Uh-huh.
So what is happening? This is going in a little bit more deep detail. I won't go into too much, but the better that you can weight bear on this leg, the more this QL will shut off.
Okay.
It's kind of counterintuitive, but that's the way it works.
Okay. Weight bear on the side that the QL is bothering you.
Typically, that's what's going on. Sometimes
Okay.
it's a compensation from the other side, but usually it's the same side.
Okay. Thank you.
Yeah, I hope that helps. Thanks.
Yeah.
Okay, we also have Charmian. I'll read this and then I'll let her unmute. I have 10 years chronic shoulder pain. Pain is in muscles of shoulder, especially rhomboid, pecs, deltoids. The pain switches sides every few days. Can one of your programs help me, or should I do a Zoom appointment with you?
Yeah. And what was the name again?
Charmian, Charmian. Let me see if she's still here.
Charmian. All right.
Hi. Yeah, I'm
Hi,
here.
Charmian.
Hi.
How are you?
I'm good.
Good.
Thank
So yes, so if you remember, I'll scroll back to it. Here it is. See this Heal Your Headaches program?
Yeah.
My secret weapon to heal headaches is fixing the shoulder girdle system.
Okay.
So do you also have neck pain or headaches?
I don't have headaches, and if I have neck pain, it's only when the shoulder pain grows up into my neck, like it's
There we
not
go.
isolated in the neck.
Yeah. So I think that would be the program for you.
Okay.
And I think, Alan, aren't we going to be having a neck pain and headaches webinar sometime in the next few weeks?
I believe it's going to be in the next 2 weeks or so.
2 weeks. So, if you want, you should dial in because I'm going to explain why that causes neck pain and headaches and what we typically do to solve that kind of stuff.
Okay, yeah.
but
'cause
anyway,
I have
it's
your shoulder pain book, and I just got the neck and headache pain book like the other day, because something I read of yours said that's where I should be directed to for shoulder pain. And I'm just a little like, I feel like I don't know which exercises I should focus on.
yes, yes. And I'm sorry for that. And that's exactly why I made these downloadable programs, because I wrote those like 12 years ago. And so I didn't want to take anyone down a specific course, because there's so many different courses that people are coming from. So I couldn't say you have to do this because, well, person B doesn't have to do that, right? So I just put the exercises in there that will solve just about everything, but it's too broad based, and that's why I created these programs. And also I've seen the patterns. So the Heal Your Headaches program has all the information. Then I think if you look at the two books closely, you'll see the exercises are very similar. How I solve shoulder issues is the same way that I solve the neck issues. So what I would do maybe is find the common exercises and do those. And there's
Okay.
going to be maybe 4 or 5.
Okay.
Yeah, it
Okay,
shouldn't
great.
be that long. Yeah, but here's the thing that is missing from those books also, is that I have developed some really powerful taping techniques to help the shoulder system work better, faster. And they help you see how you would feel if the shoulder system was working perfectly. And so that's what we use in my clinic, and it really works really well. But anyway, those aren't in the books. They're in the downloadable program, but try the books thing first and see where you get with that. I've just done it much better in my program now. And that's why, for that reason. So,
Okay, great.
But you're right. Yeah, it is the shoulder that is the problem, but the neck and the shoulder book will be very similar. And, you'll see that when you read them and you look at the exercises, do the common ones.
Okay, thank you so much.
All right. Thanks for being there.
All right, Rick, that's all the questions we have for now. I mean, if someone else does have a question, they should certainly ask it, because we're still here.
Okay. Well, if no one has any questions, then we can sign off, I think.
Okay, somebody's raising their hand. Looks like David is raising his hand.
Oh, okay.
David, you can speak. I think you're unmuted.
David?
Hands up. Don't hear him speaking yet. Maybe his mic is trying to get together. I don't know.
And David, if you have a question, you can also type it in the chat if you find that something's going on with your mic or video.
All right, so aside from David, does anyone else have a question?
Okay, everyone. Well, thank you for joining me.
Rory is asking, will the recording of this session be sent to us? Absolutely. Yes, I will make sure.
Yep. That'll come out, what, Alan, a couple days?
Couple days, yeah.
Yeah.
Someone asked, do we have a knee pain seminar coming up? Yes. So what we're going to do is we're going to be separating these every 2 weeks or so. And we've got something special coming up next week that, because you're here, we'll just tell you about it briefly. Next week, we're going to have a PT Q&A day. So no matter what part of the body you have a problem with, we're specifically answering questions for 60 minutes next Thursday. You're hearing about it here first. That's what's going to happen next Thursday.
All right, everyone. Well, if there are no other questions, we will sign off, and thank you everyone for joining us. And I wish you well. Have a good night.